There's now new data showing how Medicaid expansion under the Affordable Care Act has actually yielded some significant gains when it comes to maternal mortality. Something that the United States should be incredibly embarrassed about because we have the highest mortality rates for mothers compared to other developed countries. So in this case, the report focuses on how Medicaid expansion under the Affordable Care Act helped lead to a decline in postpartum hospitalizations and deaths. So as the Hill reports, states that expanded Medicaid under the ACA, Affordable Care Act, saw a 17% drop in hospitalizations among women during the first 60 days postpartum. So I didn't know this, but many hospitalizations of new mothers happen postpartum, right? Not when they're pregnant, although that happens as well. And when you live in a system that really mostly relies on privatized healthcare, that is astronomical, a lot of Americans can't afford it if they're not receiving it through their employer, well, you're gonna see high mortality rates. And in this case, of course, we're talking about maternal mortality rates. So compared with 10 other developed countries, the United States ranks worst when it comes to maternal mortality, while data show over half of maternal deaths occur in the postpartum period. The United States is also the only developed country that does not guarantee access to provider home visits or paid maternal leave during this period, according to the Commonwealth Fund. So this is why I don't believe the anti-choice organizations who say that their stance on abortion has to do with human lives or saving human lives. Because if they genuinely cared about human lives, there's about a million other things they could do that would actually improve healthcare in this country, that would actually improve the likelihood of a new mother surviving postpartum. But they don't focus on any of that at all. All they seem to focus on is just banning abortion in the country. And I think it's really about controlling women, and I think it's about punishing women who are dealing with unwanted pregnancies. Because in their minds, you shouldn't engage in any sexual behavior unless you are doing so to procreate, because they're lunatics who want to control our personal lives and they really have no place doing so. But nonetheless, let's go back to the topic at hand, because again, we're talking about actually saving human lives through improving our healthcare system. Now, in this case, it was through the expansion of Medicaid, which not every state accepted and adopted. So even today, we have an issue with that. Medicaid expansion permitted states to cover most adults with incomes up to 138% of the federal poverty level, allowing a larger share of low-income individuals to qualify for coverage. So when the Affordable Care Act passed, states were notified that they can expand their Medicaid programs with federal money. So the federal government was like, yo, take our funds, take the money so you can expand your state Medicaid programs to cover more people. But not every state accepted it. Until this day, we have about 11 red states that have given the federal government the middle finger to own the libs. Yeah, real slick, okay? Risk the lives of your own constituents to own the libs. Congratulations, you guys are really nailing it. So let's talk about that. To date, 40 states, including DC, have adopted the Medicaid expansion, and 11 states have not adopted the Medicaid expansion. Okay, so which states are we talking about? Why don't we take a look at this handy map of the United States? All of the yellow states indicate the states that have refused to adopt the expanded Medicaid program: Wyoming, Texas, Kansas, Wisconsin, Mississippi, Tennessee, Alabama, Georgia, Florida, and North and South Carolina. The reason why South Dakota is a lighter shade of blue is because the state did in fact adopt expanded Medicaid under the Affordable Care Act, but for some reason they have decided that they're not going to implement it, or they haven't implemented it yet. I don't know what's going on with South Dakota. I think it's weird, especially because, again, we're talking about states rejecting federal money that would improve the lives of their own constituents. They're like, nope, we'd rather own the libs. Okay. Now, I want to give you some more details on that because it's just so ludicrous that these states refuse to expand their Medicaid programs. So an estimated 700 to 900 women in the United States died of pregnancy-related causes in 2016. That's pretty bad. But the numbers have only either remained terrible or in recent years have gone up a little bit. So in 2020, for instance, 861 women were identified as having died of maternal causes in the US compared with 754 in 2019. The maternal mortality rate for 2020 was 23.8 deaths per 100,000 live births compared with a rate of 20.1 in 2019. Now, the coronavirus pandemic probably contributed to the increase in maternal mortality rates. A lot of hospitals were slammed with COVID patients. Maybe some pregnant mothers didn't want to go to the hospital either while they were pregnant or postpartum, just to avoid the possibility of being exposed to COVID patients. I don't know, but I would be shocked if COVID didn't contribute to some extent. But we should look at some specific states here, like Georgia, for instance, one of the states that has refused to adopt the expanded Medicaid program. Georgia has the second highest rate of maternal mortality, so that's 48.4 per 100,000. Georgia's maternal mortality review issued a 2017 report that said the areas of highest concern include inadequate follow-up of cardiovascular symptoms in pregnant women and failure to recognize and treat hypertension or hemorrhages soon enough. By the way, researchers have reported that in more than 1/3 of cases, they were unsure of when prenatal care began for mothers and confirmed that some who died received no prenatal care at all. Gee, I wonder if concerns about the cost of prenatal care played a role there, especially in a state that refused to expand Medicaid for mothers, pregnant women who, maybe don't have the means to get coverage through the private insurance market. Now, other Medicaid denying states aren't doing so well either when it comes to mortality. So let's take a look at that. Alabama's one of those states. So 36.4 mothers die per 100,000 in the state of Alabama. In Texas, it's 34.5, and in South Carolina, 27.9. Why don't we compare that to a state like California, which of course actually protects reproductive rights and also, of course, has expanded Medicaid under the Affordable Care Act, has the lowest maternal mortality rate. So 4 mothers die per 100,000 deaths. I'd like to see that number go down to 0 because I actually care about human lives, as opposed to the anti-abortion advocates out there who have focused all of their attention on zygotes and embryos. When it comes to living, breathing humans, when it comes to providing the healthcare we all need to live and thrive, they don't seem all that concerned about that, do they? It's almost like the anti-abortion movement is really about control and punishment.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.